The Penuma is a silicone implant for the penis to enhance penile girth and flaccid penile length. It was invented some 20 years ago, and until the year 2022, over 5,000 men in the US had undergone the procedure. The Penuma has a high degree of satisfaction among users, but it also has its drawbacks. In this video, I will explain to you the Penuma in detail, how it is implanted, and why you are maybe not the ideal candidate. My name is Stefan Buntrock. I'm a board-certified urologist and sexologist. This video is not sponsored by anyone. I am explaining the product to you free of any financial obligations. I have not, nor will I receive any benefits from the manufacturer of the Penuma for making this video. The Penuma is the only FDA-approved silicone implant for penile augmentation in the US. In other countries, they sometimes use silicone implants, which I think make your penis look like a pipe sleeve. These are not really approved. But let's concentrate on the Penuma. First of all, stay realistic. And that applies pretty much to penile enlargement on the whole. Don't expect to turn your penis into the trunk of an elephant. That won't happen. An average gain of 3.4 centimeters plus minus 1.1 centimeters in girth is realistic for the Penuma. This means an average gain in girth of 1.3 inches on average. Flaccid length increases on average by 3.8 centimeters plus minus 1.9 centimeters, and that equals 1.5 inches on average. I hope you have watched my previous videos on penile enlargement. If you compare the numbers, you will find that you can achieve almost comparable results with less risky methods and much cheaper. Because according to the Penuma website, the procedure is quite pricey, $16,000 to $18,000 US. By the way, did you know that you can become a member of UroChannel? I just started memberships. Check out the perks and become a member today to support my work. Your membership helps to maintain the high quality of my content. Many hours of preparation go into each of my videos to bring you the most up-to-date scientific knowledge possible. So, the Penuma almost has the shape of a cigarette tube, but it is not completely circumferential. Otherwise, it would compress the urethra, and we don't want that. They used to insert it through a small incision just above the base of the penis. But about 2 years ago, they introduced a new technique called the concealed technique. They started to insert the implant from the scrotum. The skin in this area has wrinkles, so after 3 months, the scar will be invisible. As I said previously, patient satisfaction with that method is high. In the studies conducted, 96% said they were satisfied or very satisfied with the appearance of their penis after the procedure. In another study, the number was 81%, so very high satisfaction rates. Also, an increase in self-confidence long-term could be observed. 83.5% high or very high levels of self-confidence 4 years after implantation. This was the sunny side of the method. But as in any surgical procedure, there is a chance for complications. From a surgical perspective, complication rates are low. But that doesn't help should you be so unlucky to become the one affected. Of course, we're talking about infections because it is foreign material that is implanted. Infections may become quite nasty. At worst, the implant will have to be removed. This is not good because then scar formation, penile shortening, and banding suddenly come into sight. And if this happens, you wish you've never had the idea to get the operation in the first place. There is a small chance the implant can migrate, even though it is initially tied to the tissues. It may also break. Patient selection is important because not everyone is suitable for the method. To begin with, only circumcised men qualify. I know many of you will hate that piece of information. If you are not circumcised yet, you will have to, which will add another $1,500 to $5,000 to your bill. Circumcision is important so that the Penuma stays in place. Smokers don't qualify. They will have to quit smoking for quite a while before the procedure. Former smokers have an elevated risk for complications. Any previous penile enhancement procedure will be a problem. PMMA is a no-go. If you want to know what that is, watch this video. Diabetes will increase the risk for complications. Body dysmorphic disorder with the so-called small penis syndrome definitely is a no for any penile enhancement surgery. So you see, there are pros and cons. Penile enlargement is serious business. Reputable doctors will take on the responsibility that goes along with it and select their patients carefully. If you get a no on penile enlargement from your doctor, you should take that no seriously, because sooner or later you will find someone willing to fulfill your desires. But it may not be in your best interest. But once you take that step, it cannot be made undone. Thanks for watching. Bye bye. Ich weiß, dass meine Videos auch viele Menschen in Deutschland erreichen. Anfangs war UroChannel zweisprachig, aber nach einer Weile erwies sich das als nachteilig. Daher habe ich deutsche Videos vor ein paar Jahren ausgelagert. Sie befinden sich nun auf meinem Kanal Urologie.